Hello, I'm Dr. David Greene, CEO of the Arizona Pain Network, where we connect those in pain with pain management relievers throughout the greater Phoenix area. Today the topic is sacroiliac joint pain. What are the best treatment options to help it? Well, here's a model of the spine, okay? You have your lumbar spine and then your sacrum. And on either side, the sacrum connects with the ilium. Okay, so you have the sacroiliac joints. Now they're long joints, and as you can see, they're fairly irregular in appearance. And when they have arthritis, they tend to get jagged, and they can be difficult to get into if someone's going to try and inject it. Okay, you can see that there's this overhang here with the ilium, so oftentimes that's a wicked angle that someone has to go in at. So let's talk about the best treatments. Well, these joints do have cartilage, just like your hip, your knee, and they're prone to arthritis. Okay, there is a little bit of micro motion in those joints, so enough to cause pain when arthritis is present. And it's very common. Up to 25% of low back pain can be caused from pain emanating from the sacroiliac joint. So pain management doctors can elicit whether or not the pain is coming from the SI joint. They can look at x-rays, MRI, do physical examination, and they can often tell. One of the best ways that they can test for it is actually to do an injection of numbing medicine into this joint, whichever one is arthritic, and see if it gives pain relief. Well, I'm going to tell you some of the best ways to get pain relief from it, and one of them is anti-inflammatory medication. You know, Motrin, ibuprofen products, those can be very helpful along with Tylenol. It might sound minor because they're over the counter, you know, and pretty obvious, but it may be all that is necessary. Just make sure to take them according to the manufacturer's recommended dosing. For periods of acute exacerbation, a pain management doctor may prescribe something stronger short-term. Prescribing a narcotic long-term for a sacroiliac joint problem or any arthritis type of problem is not a good idea. Okay? Now, chiropractic treatment can be very helpful as well. There are some mechanisms they can try to provide relief in these joints. All right? A TENS unit can be very helpful. Ice, heat, electrical stimulation, physical therapy can also be very helpful as well. All right? So now when we get to interventional pain treatments with a pain management doctor, first and foremost, one of the best treatments is a simple steroid injection into the arthritic joint. And that can provide weeks to months of pain relief. The best pain management doctors, such as the ones that we work with at Arizona Pain Specialists, put the steroid injection into the joint under fluoroscopy, which is a real-time form of x-ray. Ultrasound can also help a lot. But to do it blindly is oftentimes you'll miss. So the best pain doctors use fluoroscopy. Now, if the injection works and then wears off, the newest treatment for this pain is radiofrequency ablation, which is when a pain doctor will put a needle around the joint and then provide thermal energy to deaden those tiny little nerve endings that are causing pain in the joint. And that can provide pain relief for over 6 months at a time. Okay? So between the chiropractic, the physical therapy, the medications, along with the injections or the radiofrequency ablation, pain relief can be achieved in the vast majority of cases. In Arizona, the preferred pain doctors that we work with are at Arizona Pain Specialists. They have 5 locations. They accept every major medical insurance. They have double board certified and fellowship trained pain doctors as well as chiropractic doctors. They're award-winning. They're very empathetic, compassionate, and highly skilled. Call the number on the screen, which is 602-507-6550 for the best pain management throughout the greater Phoenix area. I'm Dr. David Greene with the Arizona Pain Network. Your pain.